Did you know that people often confuse osteoporosis with osteoarthritis? This is Dr. Alan Jacobs, and I want you to know that osteoporosis is a bone disease that causes fractures, while osteoarthritis is a deterioration of a joint. The fractures due to osteoporosis are very common and have very severe consequences, especially when they involve the hip and spine. Our bones get weak with age due to two separate problems. First of all, bone calcium is lost very gradually in both men and women after the age of 40. However, women have much higher bone loss during the 5 years after menopause. When enough calcium has been lost, bones are not strong enough to handle the work they have to do, and fractures may result. The second factor that leads to fractures is the effect of age on the skeleton that is called brittleness. This is similar to how a green twig can easily bend compared to a brown twig that will easily snap and break. The three most common factors that lead to osteoporosis are age, positive family history, and being a female. 80% of our bone density is determined by inheritance. Having a parent who had a hip fracture creates a greater risk for osteoporosis and fractures in the children. Fractures begin to appear around age 65 and escalate every year after that. Other important factors that may cause osteoporosis include not living a healthy lifestyle, having certain medical conditions like rheumatoid arthritis, or having a low vitamin D level, and taking certain medications like prednisone. There are two ways to determine if osteoporosis is present. The best method is a bone mineral density test, also called the BMD. This measures the quantity of calcium in the spine and the hip. A calcium value below a certain level is by definition called osteoporosis. Osteoporosis can also be present in X-rays when it is very advanced and has already caused fractures. It is interesting that the majority of fractures from osteoporosis that occur in the spine do not cause pain, so X-rays can be of great help. There is now an excellent way to calculate your individual risk for getting a fracture using what is called FRAX. This is done simply by answering 6 questions and combining this with results of the BMD test. A computer program uses this information and then calculates the risk of getting a fracture of either all types or specifically in the hip in the course of the next 10 years. This prediction can be used to decide who needs treatment and who does not. This has been Dr. Alan Jacobs, and I would suggest that you discuss your osteoporosis questions and risks with your healthcare provider.